What are hormonal implants and how do they prevent pregnancy? Hormonal implants are a method of long-acting hormonal contraception. They consist of a flexible plastic rod that is inserted under the skin of your upper arm by a healthcare provider. They are about 1.6 inches long or 4 centimeters long and about 1/8 of an inch in diameter. So think the size of a matchstick. The insertion of a hormonal implant is fairly simple and can be performed in office. You start by taking a pregnancy test to make sure you're not currently pregnant. Your provider will then inject a small amount of numbing medication in the area of insertion, and the implant is then inserted just under the skin of your upper arm. You don't require any stitches, but your provider may place a bandage on your arm. The entire process takes only a few minutes. An implant can be inserted at any time during your menstrual cycle, but depending on the day of your cycle when your implant is inserted, you might need to use backup contraception for a few days. After insertion, you might experience some initial side effects such as spotty menstrual bleeding, sore breasts, headaches, acne, or mood swings, but most of these side effects should subside within a few months. So how do these hormonal implants work? Hormonal implants contain progestin, which is a synthetic form of the hormone progesterone. They work by releasing a small, steady dose of the hormone into your body. This progesterone prevents pregnancy by suppressing ovulation or the release of eggs from the ovaries, by causing a thickening of the cervical mucus, which makes it more difficult for the sperm to swim up and meet the egg. And it also causes a thinning of the uterine lining, which prevents a fertilized egg from attaching to the uterus. Some advantages of hormonal implants over other methods of contraception are that once inserted, these can prevent pregnancy for up to 3 years. You don't need to remember to take a pill every day or an injection. But if you do decide to get pregnant sooner, your healthcare provider can take the implant out at any time. Once the implant is out, you can start trying to get pregnant right away. This is also a progesterone-only method of contraception, so some of the side effects of estrogen, such as blood clots, can be avoided, and these implants can also be safely used while breastfeeding. Once inserted, hormonal implants are more than 99% effective in preventing pregnancy. They don't, however, protect you from sexually transmitted diseases. So if STDs are a concern, it's always a good idea to use condoms in addition.